Welcome to Aging Untold. With medical marijuana now legal in at least 40 states, plus the District of Columbia and Puerto Rico, some families may be wondering if cannabis edibles can help with dementia symptoms like agitation, memory loss, and sleep problems. However, there are concerns about the risk outweighing the benefits. Sam, how common is this treatment, and what are your main concerns about using gummies for dementia?
So it is growing in popularity, and I'm not against its use in a controlled environment for the right reasons. But what we don't want to do is just over sedate somebody because they're easier to control. And we've seen that with, truthfully, we've seen that with synthetic drugs throughout, especially in communities. And so that's not something that we want to take on in the home, and because they're becoming readily available, I worry about that. You know, you can oversedate somebody, then you've got to increase fall. Now with somebody that's already got dementia, could we increase their confusion? Yes, we could. We could cause all kinds of problems along the way with this. So I always tell people, you know, be very careful. You can lower your blood pressure and the overuse. So gummies take a little longer to kick in.
I've heard.
Have you? And so while you're waiting, if you're impatient and you're wanting that behavior to change, are you giving an extra gummy? And then all of a sudden the person has too many on board and you're in a bit of an overdose.
You have to take into account also that an older person, their metabolism is not as efficient as it is when you're younger. So now you're giving something that's delayed and there's another delay. So it's really an unpredictable effect on it. But you know, our body has our own internal endocannabinoid system. We have that inside of us, and it hits all receptors, and it's like a communication network. And it does the same thing in terms of regulating appetite, mood, pain, and all those different things. And so when you exercise, you actually hit that system. So that's how you get that same runner's high from endorphins. You get it from exercise, from this endocannabinoid system.
So running's like smoking weed.
Exactly.
Right, there
Now
you
I
go.
know why there's marathon runners. Never understood it before.
There's two behaviors we're really talking about here, aggression and agitation. That's the hardest stage for caregivers to manage. And so it's been studied, and it's been successfully studied at the Fisher Center for Alzheimer's Research, and it's also been studied at Johns Hopkins, and it's been very successful at managing the behaviors. Now, I in no way would say, oh, use this instead of trying everything else. Non-pharmacological is always the best solution, but I think I was thinking about this woman that called me from her laundry room. She was kind of stressed out about her husband, and she didn't want him to hear her. She had just given him a gummy, and she said, I feel like I want to take one too. Be careful.
Maybe
Be
it's
careful.
better for the caregiver sometimes to take the gummy versus
You take the gummy.
Yeah, you know, you can manage the aggression and the anxiety if you're just a little more relaxed.
And if you're out there
Yeah.
wondering, how do I choose? You can talk to a doctor. You can
But
talk to a healthcare provider.
One of my biggest concerns is if we're agitated and the behaviors are there, have we ruled out treatable causes first? Or are we just assuming that this is normal? Because aggression and agitation are not normal dementia symptoms. And I can't say that enough. They're not normal. There is something going on, and we need to get to the
Because
root.
they
I'm going
can't
to politely
communicate. They're
disagree.
trying to tell you
It's
something.
it's a common behavior that doesn't have to be solved with medicine. And I don't like the word normal so much. It's just common. I wouldn't want anyone to
It can
think
be
that.
common, but I think we're saying let's get to the root cause of why it's occurring. And if there's not one, then maybe gummies.
Maybe there's an infection going on
Yeah.
that's causing the behavior.
Or the caregiver needs more training, more tips, more solutions.
Yep.
And there's something to really do. I like what you said about not over sedating someone's. And
The
also
other thing,
though, I
in
like
terms
being
of
curious.
education, you know, you have all these states that have the medical marijuana. There's a lot of education. A lot of physicians, we don't really know that, but there's online things and there's organizations where you actually can go and learn the difference in the composition, concentrations, and all that, so you have a better idea of when to utilize these agents.
So I actually do know a physician in our hometown that's very engaged in medical marijuana, has treatment, and she's been working with the governor on this.
In
and
Kansas?
So, yes, in Kansas.
It's not legal.
they're working on getting it to be legal.
Now in Oklahoma, where I'm licensed, it is legal, but I know in Kansas it's not.
So Kansas might be one of the last states, but there is a physician, at least one that I know of, that's really actively working on this because it can help with symptoms. I think the big thing is that stay curious about everything, but stay curious because when you're out of options, there might be something out there, and this could be directed through a physician. You don't have to go shopping on your own and say, I'll take the red teddy bear and the pink giraffe. You could actually have a doctor prescribe it.